Hi everybody, this is Dr. Manuel Vode. I'm here with Dr. Leos from San Antonio Medical Associates. We're a primary care group in San Antonio, Texas with 2 locations, one on Broadway and the other one at the Knicks downtown. So we're here to talk to you today about a common problem that we have, and that's our diabetic patients and their hesitancy to start insulin. Would you agree with that?
Definitely.
Okay. So what we're here to do today is kind of demonstrate on what it is like to inject insulin into a patient. Now, I'm not diabetic, but we're going to use a demo pen with an actual needle on it to show where we inject and that it's actually not that painful. Now, insulin should not be considered a last resort. Okay, it should actually be more of a beneficial thing to patients because that's really the best way to control diabetes. You know, we have medications, but most patients are very hesitant to then start insulin, even though it's a very good option for them.
I agree. There's actually many reasons why insulin is probably underused. Very common reason is patient hesitancy, just a fear of the needles. And we're hoping that through our demonstration today, you'll feel more comfortable. It's actually very easy to use. They now come in pens, so very user-friendly. You don't have to necessarily deal with a vial and a syringe separately. You can carry the pen around with you, and the needle's very small, which we'll show you today. So I think that's a big hurdle among some others, and we're hoping that this demonstration will give you a better sense of security in the role of insulin on everyday diabetic use.
All right. So
and it's definitely, insulin is not for end-stage diabetes as I hear. It's really a matter of controlling your glucose by any means necessary to stay healthy. So we're going to show you the supplies. We have here an unnamed
insulin pen.
Insulin pen. And then we have the needle. They usually come in a separate container as such.
And then alcohol swabs, very important to always prep the area before you inject just to get rid of any contaminants that might be on the skin.
All right. Other thing I'm going to show you. So first, generally what you want to do is you want to prep the area. Probably the best place to inject insulin is in the abdominal area. Upper, lower. I prefer that people do it in a different site if they're injecting daily. Definitely different site. They can go from one side to the other just to keep track. You want to use the alcohol swab to clean the area first. You want to do it standing up?
Yep.
Okay. All right. So
I'm just going to bring my shirt up.
He is going to, he has volunteered, by the way. So I'm just going to clean the area, and I'll remember where the area is. And then we're going to take the needle. You want to use a new needle with every injection.
Yep, very important.
I actually have seen this occur where people want to save some money and reuse their needle. Big mistake. So the needle is now attached, and as you can see, it still has the protective covering. We're going to take that off and look at the size of that needle. I don't even know if you can appreciate it on the video. It's very tiny. I don't know if that makes it easier, but it's very small. So we've cleansed this area already with alcohol. We're going to take the skin. I am a firm believer in the squeeze technique. By squeezing the skin, it doesn't hurt as much. And then we just, if you prime the needle, if you have the kind of insulin that needs to be primed, you would have primed it by now. And now you've rotated it, you're ready to inject it. You put it in the skin, press your button, and there you go. You take it out. As easy as that.
I did not feel a thing, and that is the first time I've ever been in or had a insulin needle put into my body.
And again, squeeze
amazing.
And put it in. I had referred to priming. In some cases with your needles, with your insulin pen, you need to prime it, which means you put enough insulin in to take up the space of the needle, and then you dial it up to whatever dose your physician has told you before you put it in. Of course, when you're prescribed this, these steps will be reviewed with you at the office and also with the pharmacist.
Okay. So thank you very much for watching our video. If you have any questions, if you'd like to come see us, we're San Antonio Medical Associates. We're a primary care group here in San Antonio. We handle everything from hypertension to high cholesterol and diabetes and, you know, all the way up to insulin patients. So come and see us and we'll be happy to take care of you and your family.